Good afternoon, everybody. Thank you for joining us for a second webinar about Virginia OSHA's new COVID-19 Emergency Temporary Standard. We visited with you all a month or so ago, or actually a few months ago, when the new rule was promulgated by Virginia OSHA, and we thought it would be a good idea to get back together here a few months later to talk about what we've learned about the rule since it's been implemented. The agency has issued some very helpful frequently asked questions and had the opportunity to get out in the field and see what employers are doing or not doing, and to learn, a little bit about how the rule works in implementation, in practice. This is, the last year with this pandemic, it has been one of these situations where I feel like we could do an update webinar every day and we'd still be outdated. So we're very pleased to be able to have the opportunity to visit with you again about the Virginia rule. And that's what we're going to be talking about today, what you need to know about Virginia OSHA's new COVID-19 standard. The first faceless voice that you're hearing from right now is Eric Conn. I'm one of the founding partners of Conn Maciel Carey, and I chair the firm's national OSHA practice group. I'm based out of Washington, D.C., but we have offices all around the country, and we practice extensively in Virginia. I'm very pleased to be joined today by Susan Wilcox, a consultant with Safety Resource Associates, a certified industrial hygienist, and also by a special guest from Virginia OSHA, Jennifer Rose, the Director of Cooperative Programs with the agency. As we go through the program, I'm going to ask Jennifer and Susan to introduce themselves before the sections that they're primarily going to be covering, but we may also, all three of us, be chiming in at different points of the program today. So to start us off, here's the agenda for today. We're going to cover a little bit of background about the VOSH COVID-19 Emergency Temporary Standard. And by that, I mean how we got here. How is it that Virginia came to promulgate this rule? And then we'll talk a little bit, again, about what's in the rule. What does the rule require? And we spent a good chunk of the last webinar on this, on that particular subject, because the rule was brand new. I'm going to try to do that in a much shorter time this time so we can talk about some updates since VOSH has issued the rule. And Jennifer is going to talk through, what the agency is seeing out in the field and some lessons learned in that regard. We'll also talk about some of the FAQs that the agency has issued and that we also have been fielding ourselves about the rule and about, implementation and compliance with the rule since the time that it was issued. And then finally, we'll close out the program with some practical tips and strategies for managing this pandemic in the workplace and how that fits together with, not just minimal compliance with Virginia OSHA's rule, but best practices and good strategies to avoid outbreaks and transmission within the workplace, which is everybody's goal. I've introduced myself a little bit already. I just add that I've practiced exclusively in this field of workplace safety and health for 20 years. The first decade or so, I practiced alongside the former first general counsel of the OSHA Review Commission. I practiced at very large firms until 6 years ago, launching my own firm, Conn Maciel Carey, where we specialize in workplace safety and health law and labor and employment law. And I work with employers, sort of soup to nuts workplace safety and health practice, assisting with inspections, investigations, enforcement actions involving federal OSHA and the state OSH plans, and the other alphabet soup of agencies that get involved in workplace safety and health matters. And for the last year, for 19 years, I thought I couldn't have or be involved in a more specialized legal practice than I have been in. OSHA, workplace safety and health, very narrow niche practice. The last year, I've been even more narrower and more focused. I feel like I've been a COVID-19 workplace safety and health lawyer. I co-chair our firm's COVID-19 task force and have just been living and breathing the CDC guidance and OSHA guidance and emergency rules and executive orders and helping my clients navigate this patchwork of requirements and guidance that's out there to help keep our workplaces safe. And we've had a lot of success with that over the course of the year, and I want to share some of that with you today. Getting into the program, background about Virginia OSHA's new COVID-19 Emergency Temporary Standard. Here's Virginia Governor Ralph Northam sort of explaining why Virginia OSHA adopted this rule. Workers should not have to sacrifice their health and safety to earn a living, especially during an ongoing global pandemic. And here's the real meat of it, that in the face of federal inaction, federal OSHA's unwillingness to adopt an emergency temporary standard that could become a framework for the entire nation, Governor Northam felt that Virginia had to step up and protect workers from COVID-19, creating the nation's first enforceable workplace safety requirements. And that's right, Virginia was the first state to adopt an emergency temporary standard and paved the way. Now, since we gave our first webinar on this, since Virginia promulgated this rule, several other states have adopted similar regulations. California just finalized theirs, Oregon a little bit ahead of them, Michigan OSHA, I believe, was the second. And then there's a handful of other states that, even though they're under federal OSHA jurisdiction, have done something similar with executive orders, really focused on workplace mandates for safety and health. But Virginia really led the way on that. And that's why it's great to be able to visit with you all today about what we've learned and what the agency has learned and what employers in Virginia have learned as they've rolled out this rule, because it really was a pioneering step by Virginia. Here's just a little brief history about the rulemaking process. The concept here is that it's an emergency rule, and an emergency rule rulemaking does not look like a typical rulemaking. And if you are in this field, you know that it can often take years, sometimes decades, for OSHA to promulgate substantive regulations. This rule moved very quickly, and that makes sense because it's a public health crisis, an emergency situation. So on July 15th, the Virginia Safety and Health Codes Board adopted the Emergency Temporary Standard for Infectious Disease Prevention, SARS-CoV-2 virus that causes COVID-19. On July 27th, the standard that had been adopted was published in a paper of record in Virginia, the Richmond Times-Dispatch, and with that publication, the rule became immediately effective. One thing that Virginia OSHA did, which I think was great, that some of these other states that are adopting emergency rules are not doing, is that they had, even though the rule became effective, there was a series of implementation dates that gave Virginia employers an opportunity to get up to speed, to come into compliance, to go step by step through the requirements of the regulation. So even though it went into effect technically on July 27th, there was a 30 and 60 day and some additional time laid out for conducting some of the major pieces of what it takes to comply with the rule. The hazard assessment, the risk assessment, implementing the written programs that are necessary under the rule, and conducting the training that's necessary under the rule. Other states have not done that, and just all provisions were immediately effective when the rule became effective, which has been a real challenge in other parts of the country. The emergency standard in Virginia applies to essentially every employer and place of employment within Virginia OSHA's jurisdiction. So if you are not subject to Virginia OSHA's jurisdiction, for example, military installations and other federal installations in Virginia, you're not covered by the rule. And there's some other carve-outs for certain elements of education in the education system if you have approved rules by Department of Education, things like that. But otherwise, the rule applies generally to every employer in Virginia, general industry, construction, you name it. There are different levels of application depending on the risk level at your workplace, but at its core, the rule applies across the state. The rule is set to expire within 6 months of the date it became effective, so within 6 months of July 27th, or if it is repealed by the Safety and Health Codes Board beforehand, or upon expiration of the state of emergency, which created the basis to allow for an emergency rulemaking, or, and this is the big one, or it is superseded by a permanent infectious disease standard. And the Virginia Administrative Procedure Act, just like the Federal Administrative Procedure Act, requires when VOSH or OSHA issues an emergency temporary standard that they immediately begin work on a permanent standard to cover the same subject. They're not required to adopt a permanent rule, but they're required to initiate a rulemaking for that. And Virginia OSHA did that in this case. And I think Jennifer is going to update us about the status of that rulemaking at her point in the presentation, but that is underway. And if there is anything that is going to cause this to expire short of that 6 month window, if not renewed, it would be that it's being replaced by a permanent infectious disease standard. So what's in the VOSH rule? What are Virginia employers required to do subject to this new emergency temporary standard? We talked already about who's covered. It covers all workplaces subject to VOSH jurisdiction, and the amount of or the level of obligation under the rule depends on the exposure risk level based on the hazards present. In this instance, the presence of the risk of transmission of COVID-19 in the workplace based on these 4 categories: very high risk of transmission, high risk, medium, and lower risk. And we'll talk a little bit about what that means. Here's what those exposure risk levels mean. I assume almost everybody on this call is going to fit into the lower or medium risk category. We'll work up from the bottom of this slide. The high risk and very high risk workplaces generally include healthcare and death care. If you are, operating in a healthcare facility or a nursing home facility, a hospital, or engaged in post-mortem work in a morgue, or funeral services, there's that you're engaged in activities, or there's activities at your workplace that have a very high risk of potential for employees to be within 6 feet of an individual who is a known or suspected COVID positive individual. Those would be patients, residents in nursing care facilities that are known or suspected cases, or in the case of death care services, an individual who is known or suspected to have passed from a COVID illness. So if you are engaged in those high potential activities, aerosol generating procedures, things where you are interacting and interfacing with aerosols, or invasive procedures with patients known to be infected, that's very high risk. One step below that is in the same environment, generally in that healthcare or death care environment, although not engaged in those high risk activities. So this might be, you may not be involved in the aerosol generating procedure, but you're there providing janitorial services, housekeeping services at the hotel, at the hospital or nursing care facility. First responders, medical transport services, mortuary services that don't involve invasive procedures, but still involve a great deal of exposure within 6 feet, frequently, of known or suspected COVID cases. So let's assume that most of the folks on this presentation today are not in that discrete set of workplaces. We move on to the ones that are more likely to apply to you. Those are the medium risk and lower risk exposure level workplaces. For medium risk, we'll start here with lower now. Lower is a workplace that does not involve tasks that would involve regular or frequent contact within 6 feet of other individuals that may be COVID positive. You don't have a specific reason to believe that they are. It's not a COVID patient, but anybody could be a carrier, right? That's one of the things that's been so remarkable about COVID-19 is the asymptomatic and pre-symptomatic spread of the virus. So everyone has to be considered someone who may be a COVID carrier. So a lower risk job is one that does not even have regular or frequent contact within 6 feet of individuals that may be COVID positive. You have minimal occupational contact. There's not many or any circumstances where you have to be within 6 feet of coworkers for an extended period of time. And that you're able to achieve minimal you either don't have or you're able to achieve minimal occupational contact because of control measures you put in place. You would be in the lower risk category. I tend to think there in the lower risk category of office settings or workplaces where you can effectively engineer and administratively control out occupational contact within 6 feet. So that leaves medium risk, which is kind of everything in between, where there is some minimal level of occupational contact with other individuals, either coworkers or third parties, within 6 feet for extended periods of time, which is that 15 minutes, now 15 minutes cumulative periods of time, where you have the potential for close contacts with someone who may be COVID positive. That's a medium risk work task in a workplace that has medium risk work tasks. And we've got a list here of the types of workplaces that typically would fall into the medium risk category. That's not to say that if you're able to create, in your construction business, depending on what it is that you're doing, if you're able to implement engineering and administrative controls where there is not even minimal occupational contact, you may be able to demonstrate that the workplace is lower risk or that several tasks within the workplace are lower risk. But generally speaking, the idea is that in manufacturing, in meat processing facilities, fitness centers, hairdressers, domestic service, construction, agriculture, retail, restaurant business, those things are in that medium risk category. And what's the importance of figuring out what these risk levels are? Well, first of all, the rule requires it. It's step one of the rule is to determine exposure risk levels, conduct a risk assessment. And so we know what the categories are now, and here's how you perform that task of evaluating and determining those risk levels. You look at the tasks employees perform, the work environment, the likely or potential presence of the virus in the workplace, look at what's happening in the number of employees present, the size of the area, the ability to separate and implement that social distancing, duration and frequency of potential exposures. Those are the sort of things that you're evaluating as you try to determine your risk level. And once you determine it, that's really important because the other elements of this rule differ depending on what category you're in. For very high, and medium risk workplaces or very high, and medium risk work tasks, you basically are covered by the major components of the rule. The bulk of the rule applies when you are in those three categories. That is training requirements, which is to train on the requirements of the standard, to train on the characteristics of the virus and the methods by which it is spread in the workplace, risk factors for likely activities and tasks that are likely to result in exposures that could lead to transmission, awareness of transmission, safety and health work practices, the engineering and administrative controls that are there in the workplace to prevent spread. You're training on all these subjects as required under the rule if you're in this very high, or medium risk category. If you're in that category, you're also required to assess and provide PPE if necessary. Face masks, which technically are not PPE, are generally going to be required by this rule, but also looking for instances where other actual official PPE may be necessary. Respiratory protection, gloves, if you've got people who are involved in decontamination and cleaning of the workplace with chemicals that might be corrosive, you've got to look at eye protection and gloves and gowns and things like that. Basically think about the PPE requirements that may be unique and special because there is this new and unique hazard that has invaded all of our workplaces. Other elements of the rule that apply to the very high, and medium risk categories are the anti-discrimination provisions. You cannot, take adverse employment action against a worker who raises concerns about, reasonable concerns about the spread of the virus in the workplace, who raises concerns about the availability of PPE, who contacts OSHA to complain about conditions in the workplace. Those are all protected safety activities. And then the last big one that's required for very high, and medium risk workplaces is development and implementation of a written infectious disease preparedness and response plan. Now, I hope that 11 months to 10 months into the pandemic, that every employer in the country has developed a written infection preparedness and response plan. But in Virginia now, that is a requirement for these very high, and medium risk categories. But that's an important component for any workplace, whether this rule requires it or not. So we'll talk a little bit about what's required in those plans in just a moment. I'm going to close the loop on the hazard assessment. Virginia OSHA put together, I think, a really terrific template that employers can use to do the hazard assessment that's required under the rule. And this is a screenshot of that. And what they've done, which I think is also a very practical and good way to do this, is to break this down by job task. And within that job task, you identify what is the risk of exposure, what are the potential hazards where can transmission occur or how can transmission occur, and then identify the existing engineering or administrative controls that are in place to address that risk of exposure, or to come up with new ones, right? This is a tool to think about what would be effective controls and to communicate that on your hazard assessment tool. And it's important to do that here because you can rely on engineering or administrative controls to move from one category of risk level to another. So if you are a medium risk category, but we're able to install barriers and we're able to demarcate 6 feet of space between workstations, and we implement a mask program, and we do all the things that that make sense in our workplace to allow us to say, where we used to have minimal or even frequent close contacts in the workplace, we've been able to engineer and administratively control those out of the day-to-day work in our workplace. Therefore, we've moved from medium to lower. And you can document that on your hazard assessment, how you've done that. And then finally, on the same document, identify any PPE that might be necessary for those job tasks because of the potential exposure there. So if the job task is, sanitation, you would talk about transmission from, eye contact with the, with surfaces, working in and around areas where other people were working. So there's potential exposure to droplets and aerosolize the virus, but also the hazard of, contacts with cleaning chemicals. And you might identify PPE for both avoiding transmission of the virus as well as PPE for protecting from that chemical exposure. So that's what the hazard assessment aspect of the rule is all about. And once you determine your risk category, then you implement the rest of the requirements of the rule, including things like physical distancing requirements, communicating those effectively to your employees, using signage, training, and visual cues like demarcations on the floor, things where, like in your break room, you might close off some tables or some chairs to sort of show that distance and space that is considered to be the safe social distancing space. And then taking steps, right? So that's the communicating where you should and should not be interacting with people, but then also doing things like rotating schedules, rotating start and stop times, so employees are not coming and going through the entranceways and the break times at exactly the same time. If you can stagger start and end times for the day, stagger break times, rotate shifts so that you can decrease work site density. So you make it easier to ensure social distancing can be achieved. And then controlling access to the site, and and basically going back to one really effective practice is to have a hall monitor, basically somebody whose job it is to look out for breakdowns in social distancing and reinforcing it throughout the day if possible. Cleaning is an important part of eliminating transmission of the virus. So you need to implement an effective sanitation program. And we've got here a link to the EPA has a list of approved cleaning agents that are effective to knock out the COVID-19 virus. So, implement a thoughtful program, identifying those common touch surfaces, identifying areas in the workplace that need to be cleaned on a regular and frequent basis, identify what that frequency is, identify a way for individuals to communicate that there's a need for special cleaning because of an event or some circumstance, and then make sure that you're cleaning with the right materials. Face coverings at this point, I think we all know this is, for whatever reason, has become controversial political issue. It is not a controversial scientific issue. Masks work, they are effective, and they are a part of this this regulation. Wear a face covering where social distancing cannot be ensured, and especially for indoor work activities. The written COVID-19 preparedness and response plan. This is the other core component of the VOSH regulation. It is required that you have a written plan for very high and high risk workplaces. And it is required that you have a written plan for medium risk workplaces with 11 or more employees. One of the things that I understand from discussions with folks at VOSH is that for those smaller, medium risk workplaces and lower risk workplaces. Although there's not a requirement to have a written plan, there is still a requirement to have a plan. It just doesn't need to be documented. And how do you show that you have a plan if it's not documented? So I would recommend that everybody has a written plan, even if you are in that lower risk work category. The plan should identify the person responsible for administering the plan, and that person should have a major role in developing the plan. And another unique element driven by the VOSH rule is a very good practice everywhere in the country, but it is a requirement of the VOSH rule, is that you provide for employee involvement in development of the plan. Now, that may mean that you take a first cut at the plan and share it with employees for feedback. To the extent you have a safety committee, it can be worked through, or discussions about key components of the plan through the safety committee. Solicit feedback from employees. The key here is that employees may have a better sense of where those risk factors are in the workplace. They're out there working these jobs, performing these tasks. They may know about, there is a task that simply cannot be done by yourself. It requires two people. So we're going to have a breakdown in that 6 foot distancing for this task several times a day. So let's make sure we account for that in our risk assessment, make sure we account for that in our engineering and administrative controls, and can help with ideas for that. So that's another component of the rule. So here's what needs to be in your written preparedness and response plan: where, how, and what the sources of potential exposure to the virus are, where you have those potential interactions with the public or coworkers, where close contacts might occur, what high risk surface, frequently touched surfaces might be where there's a potential for exposure. Also identifying in the written plan, and this is the major component to me, is the engineering and administrative controls that are in place to protect against those exposures. That is the guts, I think, of a effective preparedness and response plan. It also should include the work practices, and that's similar to administrative controls, but safe work practices like personal hygiene practices, frequent hand washing, and making available, all the tools for that, hand soap and hand sanitizer. Any PPE requirements that are driven special because of the pandemic should be identified in your preparedness and response plan. Contingency plans: if you have an outbreak, how are you going to deal with that? How are you going to respond to that? As well as return to work strategies. The rule actually sets out some specific return to work strategies that you should identify. Those that you are following should be part of your plan as well. Policies for identification and isolation of infected employees. These are the policies that at a basic level that you've communicated to employees that they are required to report to you if they are experiencing symptoms or if they've experienced a close contact exposure with someone who had turned out was COVID positive. So one way to identify that is having employees report that to you. Other ways include your pre-work health screenings like temperature checks and symptom-based questionnaires, but you should have those policies. How are you going to identify potentially infected employees and isolate them from the rest of the workforce should be in your written plan. A really interesting element of the VOSH rule that is becoming more and more pervasive around the country, but really was the first I heard about this, was pioneered in this Virginia rule, was issues related to HVAC and ventilation systems. And in the written rule, and therefore I think it's a good idea to have in your written preparedness and response plan, is how you're going to evaluate and maintain your HVAC and ventilation systems to effectively move air throughout your workplace so that there's not stagnant situations for the virus to sort of build up a sufficient load that can be breathed in and make someone sick. You want the air to move. You want it to move as much as possible. You want it to be filtered as effectively as possible. So there's requirements in the rule around that. And we'll talk a little bit more in detail about that when we get to the FAQs. The last thing that the rule does and that it suggests that should be included in your preparedness and response plan are the ways that you are complying with other required elements like other Virginia guidance, like the Virginia executive orders and the CDC guidance. And one of the things that this rule does specifically is it allows you to comply with the rule by complying with equally effective CDC guidance. So if CDC has guidance on a particular topic that's also addressed by the rule, and you comply with the CDC guidance, although not technically complying with the VOSH rule, if the CDC guidance is equally effective, determined to be equally effective, that is tantamount to compliance with the rule. So if you are doing something specifically to comply with a CDC guideline that is not specifically aligned with the VOSH rule, it should be documented in your preparedness and response plan. I'm going to hand it over to Jennifer now to talk a little bit about what we've learned since that snapshot in time. The rule is finalized. It's out there for everybody. What's been going on since? And I'd ask you, Jennifer, to introduce yourself a little bit for the audience as well.
My name is Jennifer Rose, and I'm the VOSH Cooperative Programs Director for the Department of Labor and Industry. I have a little over 16 years of experience with the department, including various field positions as well as management positions. I am a certified safety professional and a graduate of Virginia Tech, and I also have my master's degree in safety and health. And today I'm going to be talking about some updates, or some basically what we've seen so far since July, when the temporary standard was enacted. What we've seen so far, and this is 2020 year to date, starting in January when we first heard rumblings of the COVID virus, our enforcement officers have fielded 9,081 phone calls. And in addition to that, they have fielded 1,304 complaints from employees related to COVID issues at their workplace. Our enforcement officers have performed 85 inspections, and of these, 28 were workplace fatalities, and then 59 hospitalizations. We don't necessarily begin an inspection because of a hospitalization, but we do get reports of those, and it goes from there. So 28 workplace fatalities. And since March, those 28 fatalities represent 64% of the fatalities that our agency has investigated so far. So that is a majority of what we're seeing as far as workplace fatalities are coming as a result of COVID. Mm. And there is a requirement for employers to report anytime they have 3 or more positive cases in their workplace. And we actually have a portal online where they can do that, and it also reports it to us as well as the Department of Health. And we have received 872 reports where employers have had 3 or more positive cases. All right, as we've said before, the ETS expires January 26th. It was only for a 6-month period. And the department receives, basically what we've done is we have that 6-month period, and at the end of it, we have the ability to extend that into a permanent standard, which is what the agency is looking to do. As part of this process, we held several public hearings and public comment periods with the Safety and Health Codes Board. On September 30th, the Safety and Health Codes Board met. We had a virtual public hearing, and the public was allowed to come and present their comments both for and against the standard. And the department received 993 written comments through the town hall for that 60-day written comment period from August to September 25th. And there were 33 written comments sent directly to the department during the 60-day written comment period. And there were 29 oral comments received during the public hearing on September 30th. Next, we had the November 12th Safety and Health Codes Board virtual meeting. And the purpose of this was to review the comments that the agency had received, as well as agency responses to those comments, which we had to respond to every single one of those comments. Our agency's response was 612 pages worth of commentary on the public comments we received related to the standard. Next is December or January, potentially, the meeting for the adoption or any revisions of the permanent standards. So the agency will hold a meeting with the Safety and Health Codes Board where they will review the proposed written standard, as well as any additional changes that we've made since we put those proposed standards available on the webpage. There is the web page if you do want to see the language of the proposed permanent standard. There are a few, I would say, minor changes that have been made. Nothing really substantive has been changed. We have had a few changes specifically related to the way that the standard interacts with CDC guidelines, because as you know, CDC guidelines are changing on a frequently occurring basis.
Jennifer, can I ask, is the permanent standard focus, is it intended to be a longer duration COVID-19 standard, or is it intended to be more of a general infectious disease prevention standard that would live on beyond the end of this pandemic?
It is a general infectious disease preparedness program, as the title suggests, of the ETS. And obviously the temporary standard right now is specific to COVID, but the permanent standard, the title of it is infectious disease control. You know, there's the potential for it expanding to other infectious diseases, but pretty much we have other standards for that, so related to things like bloodborne pathogens, or if there's other industrial hygiene standards. So it while it is generic, it is right now, obviously, even though it will be tailored more towards the COVID-19 requirements.
Great, thanks.
Once the changes have been proposed to the board, any changes that will be made compared to the text of the emergency temporary standard, we're actually going to post this on our webpage. You can kind of do a side-by-side comparison of what the emergency standard says as compared to what the permanent standard is proposing. So the next step is to publish the revised proposed standard with a 30-day comment period and public hearings, followed by one or more safety and health code board meetings to consider adoption of the final standard. All of these with the intent of having the final standard take effect January 27th, obviously, so there's no lapse in time there between the emergency temporary standard and the permanent standard. If there is a period where the temporary standard has expired and the new standard has not yet taken effect or is ultimately not adopted by the board, VOSH would fall back on using the general duty clause or any existing standards, or potentially enforcing any mandatory employment-related requirements in any governor's executive orders. Some best practices that we've seen with employees returning back to the workplace, and these are not just related to the workplace, but these are pretty much across the board for home use, public use, in employer sites, things like that. Obviously, wash your hands often with soap and water for at least 20 seconds, and especially if you've been in a public place or after blowing your nose, coughing, sneezing. And if soap and water aren't available, you want to make sure you're using a hand sanitizer that contains at least 60% alcohol. When using the sanitizer, you want to make sure that you cover all surfaces of your hands and you rub them together until they feel dry. You want to avoid touching your nose, eyes, and mouth, especially with unwashed hands. Your eyes, nose, and mouth are ways for viruses into your body. And if you touch an infected surface and then touch your face, you could potentially become infected and get sick. Best practice of wearing a face covering. You can spread COVID-19 to others even if you don't feel sick. Remember to cover your mouth and nose with a face covering when you'll be around other people. And everyone should wear a cloth face covering when they go out in public, including when you go to work. And the cloth face covering is not a substitute for social distancing, so remember to keep about 6 feet distance between yourself and others. Cleaning and disinfecting, and this includes tables, doorknobs, light switches, handles, desks, toilets, sinks, anything that are high-touch areas where common people would be touching it, you know, in the public, or there's multiple employees that are touching those surfaces. And one thing to consider too is when bringing your laptop home, you want to clean and disinfect it before using it if it's been in the workplace. And before and after eating, you want to make sure that you disinfect any common eating areas in your workplace and wash your hands. And when you are eating or drinking and you need to take off your mask, you still should ensure that you're maintaining 6 feet apart from coworkers. And the best practice that we've seen would be to have employees eat outside if possible, or you know, other ways to eat your meal away from coworkers. And then we also have seen best practices where employers are holding practicing social distancing during meetings, conversations, and tasks. Obviously, virtual meetings have been the go-to for employers that we've seen. If they do have to attend a meeting in person, obviously you want to make sure that your employees are maintaining 6 feet apart from each other. And if you need to work near or talk to a coworker, you want to make sure that you're maintaining that 6 feet apart distance, as well as using a face covering. Obviously, like I've said before, you want to make sure that you're maintaining social distance during meals and breaks. And basically, these best practices are ones that we've seen, again, in workplaces, but these are pretty much best practices for everyone, wherever you go. And it's everyone's responsibility to help prevent the spread of COVID-19, but employees can protect themselves and others by being vigilant and taking steps that reduce exposure. Some resources that I'll leave you with. The main one is our webpage. Right front and center, we have a link to a site that has all references on it. Here you can find a text of the emergency standard, as well as the text of the proposed regulation. We have a number of PowerPoint presentations on there, both that are just general information, as well as some of those that meet the requirements for training per the standard. We have templates, as Eric said, regarding hazard assessment and written plans that employers can use to make sure that they're in compliance and make the plans and the assessments specific to that employer's work site. I think coming up, you're going to go over some of the FAQs from our webpage. Again, you know, with those thousands of calls and emails that we've gotten, we've seen some common questions come up. So we've addressed those on our webpage at that resource or the reference material page. And like I mentioned before, with the reporting 3 or more cases, we have developed an online reporting portal that you can access from our webpage. And again, that's for employers who have 3 or more cases in a 14-day rolling period at their workplace. They are required to report those to us, as well as the Department of Health.
All right, thank you, Jennifer, and I do hope you stick around and chime in if I say anything in the context of these FAQs that you would put a finer point on than I have included here. But that's been one of the, you know, with any new rule, one of the things that you learn the most, or one of the ways that you can learn the most about the rule, is when it gets into effect, there's going to be questions. And we have fielded a lot of frequently asked questions from our clients. And VOSH, I mean, you heard the data from Jennifer, has fielded tons and tons of phone calls, both from employees and employers, asking about the rule and about best practices. And here's some of the FAQs that VOSH has fielded and that we have fielded that I thought would be interesting to share with you all. The one thing, as I said before, that is somewhat unique about the VOSH rule than we were seeing in, you know, Fed OSHA guidance, or really any other guidance. I think Virginia OSHA was one of the first ones out there to be talking about air handling systems. And there is a component of the rule that requires you to meet certain minimum industry consensus standards with your HVAC system. So a frequently asked question that we got a lot from some of our employers, and apparently so also did VOSH, is, does this mean we have to install an air handling system? If our workplace right now does not currently have an air handling system, do we have, you know, are there elements of this standard that we're required to meet? And the answer is no, that the standard does not require you to install any sort of new system. The requirements related to air handling systems only apply where air handling systems are already installed in your workplace. If they do exist already, which most do, I imagine, they have to meet certain minimal requirements of the ASHRAE standards. And one of those is basically conducting an evaluation of the system to ensure that it is meeting its, you know, as designed functionality. And this has involved for a lot of my clients engaging a third party, not necessarily an engineering firm, but an HVAC professional to evaluate existing systems to make sure that they're operating as designed. If there's an ability to enhance any of the air movement still within the design of the system, doing that and looking at any enhancements like using more efficient filtration systems with existing and as consistent with existing design standards for those systems. But it doesn't require you to go out and install new systems if you didn't already have a system in place.
Eric?
Yeah, go ahead.
One thing to note on that is that we did receive a lot of comments during the public comment period regarding the ASHRAE standards, and the permanent standard language actually more or less takes out that general requirement for the ASHRAE standards and puts in specific requirements that are, in my mind, less stringent than following are the requirements to follow ASHRAE standards. So that's something to be on the lookout for, is in that proposed text of the permanent standard.
Well, that's great. I'm glad to hear that. But the general concept is still there, that we should be thoughtful about our air handling system and make sure they're functioning properly, but not necessarily looking to this industry standard. Is that what we think the new rule will look like?
Yes.
Yeah, good. That's a good approach. And it's very effective. I mean, one of the things that's developed even since the VOSH standard was promulgated was the CDC came out and acknowledged that this is an aerosol transmissible disease, right? It was thought primarily to be surface contamination and then transition to droplet contamination, and now also considered to be aerosol or airborne transmissible, which means that it's important to make sure that your air handling system is functioning properly or enhancing it if the opportunity exists, because there's greater risk there than maybe was understood earlier on in the pandemic. Another frequently asked question, and this is one that it sounds like there may be some tweaks to the rule as how it interfaces with CDC guidance, but one was, can an employer comply with CDC guidance where it conflicts with a provision of the VOSH emergency temporary standard? And the answer is yes, but it sort of depends. There's a provision in the standard that says, to the extent an employer complies with a recommendation contained in CDC guidelines, and provided that that recommendation provides equal or greater protection than the provision of the VOSH standard that it relates to, then the employer's action shall be considered in compliance with the standard. So the idea would be that the employer needs to really affirmatively identify that they are following some other CDC guideline and demonstrate that to VOSH. And then under the rule, VOSH will evaluate whether it agrees that whatever that guideline is does provide equal or greater protection to the VOSH provision, and verify that the employer is actually complying with the CDC recommendation. And one of the areas, and I hope Jennifer will chime in here, one of the areas where I know this has come up a lot with some of my clients is in the context of return to work. There's a return to work provision in the VOSH rule that was based on the CDC guideline for return to work as it existed when the rule was finalized. Shortly after the rule was finalized, CDC updated that guidance, and then they had just updated it again yesterday on how long people need to quarantine, what steps should be taken before you approve someone to return to work. So, in my view, that is one of the key areas where this provision of the VOSH rule would be implicated. That, hey, we're following CDC's guidelines. They have determined it's fully safe to allow someone to work or return to work under these circumstances, even though it's a shorter period of time than the VOSH rule lays out. In my view, that would be equally effective protection, because CDC is saying it's safe to do it, and it's it should be equally safe. But I'm curious if you guys have encountered this question a lot, or other areas where CDC and the rule may diverge, and how that may be addressed in the permanent rule.
Yes, we do. There is some acknowledgement of that CDC, and really the reason that the that bit was put into the emergency temporary standard was because we knew at the time the CDC was coming out with guidelines, and that's kind of our catch-all where it says, you can be considered in compliance with our standard, whether it be the emergency temporary standard or the permanent standard, as long as you are in compliance with specific CDC guidelines. And I think we've kind of firmed up that language in the proposed standard of the permanent regulation. So it kind of, again, reifies that when the CDC makes changes that we can't obviously change our permanent standard time. CDC makes a change. So basically we're saying, compliance with CDC is considered to be technically compliance with our standard. And, subject to a citation, it would only be a de minimis violation. If there were an issue where, it wasn't as effective as the requirements of the standard.
Very good. All right. A couple other questions that we've gotten a lot of is if you have multiple workplaces around the state of Virginia that are substantially similar work activities, substantially similar configurations in the workplace, can you perform a single risk assessment? Remember the COVID-19 risk assessments, that's step one of compliance with this plan, and have that sort of umbrella assessment apply to each location? And the answer is essentially yes, that you can prepare a risk assessment that provides corporate-wide risk classification of job tasks. However, you've got to be sure to be on the lookout for any unique tasks that might be present at one workplace that are not present or incorporated as part of the corporate-wide or statewide risk assessment that was performed, and make sure that you're addressing any of those unique tasks in terms of classifying them, identifying the engineering and administrative controls and the PPE that may be necessary. But if they are identical tasks and identical configurations, one assessment is fine. If they are substantially similar, still one assessment is fine, as long as you're addressing any unique tasks on a location by location basis. So that's one way to ease some of the burden of this of the rule there. And here's an interesting one where the question we get often is, do employers need to conduct contact tracing if one of their employees turns into a confirmed case? And what's interesting about it is the rule has a explicit provision that says nothing in this standard shall be construed to require employers to conduct contact tracing. And the idea is that the health department is doing the contact tracing. They're the experts at it, and they're doing that very effectively. So the rule does not require it. However, the rule does require certain notification provisions that I'm going to talk about, I think, on the next slide, notifying coworkers if they have had contact with somebody who it's later turns out has tested positive. And so, although not technically required to be official contact tracing, there's some element of contact tracing that needs to be done in order to meet those notification requirements. You need to understand who had contact with an infected worker or an infected contractor or an infected visitor to be able to make that communication that the standard does require. So it's not technical contact tracing, but some element of tracing is needed and is generally a good practice.
Absolutely. Eric, this is Susan. If I could just jump in here, I'm going to speak to that in my presentation, how important it is that we do recommend employers do their own contact tracing. I'll speak to that a little bit in my presentation.
Great. Yeah, so I'll save that for that then. So the last thing that I'll talk about here are what are the Virginia unique required COVID-19 notifications. I think everybody sort of around the country understands their hospitalization and fatality reporting requirements under OSHA's and VOSH's injury and illness record keeping and reporting standard. The VOSH rule introduces some new notification requirements. And Jennifer talked a little bit about the three or more employees testing positive and some of the data that the state has amassed since the rule has gone into effect. Let's talk about what these unique notification requirements are. First, this rule requires Virginia employers to notify the Virginia Department of Health within 24 hours of learning of a positive case involving one of their employees, regardless of work relatedness. Now, the Department of Health generally has kind of suggested that they don't really want or need this notification, that they're getting all these notifications from the testing centers, but it's in the rule, you're required to do it, and they've identified some avenues to how to make that report. The portal that Jennifer talked about, I think, accomplishes the report to both VOSH and the Department of Health. If you're doing that, I guess, for the three or more employees. There's also a portal for the Department of Health to make these individual case reports as needed. The big one, yes.
One thing on that, and the agency, we are working cooperatively with the Department of Health. We actually have weekly conference calls with them. They are looking at changing that requirement of the one case of reporting. So that may be something that we address in the proposed text as well, that
Right.
we might change that further than what's actually written online in discussions with the Department of Health. For that reason, like you said, they're getting inundated with those single reports.
Yeah. So it may end up being that it's the 3 or more cases or what's getting reported to both agencies. But right now, that's what the law requires, at least for the next month and a half. The big reporting requirement, though, the big unique reporting requirement under this rule is that there's a requirement to notify VOSH within 24 hours of learning that 3 or more employees in the workplace tested positive in the same rolling 14-day period. And again, that's regardless of work relatedness. So these are cases that could be brought from, so one of your employees did Thanksgiving with a big group, and multiple people got infected during that Thanksgiving celebration, comes into the workplace. It turns out I've tested positive, but I was at work for 2 or 3 days over the course of the last week. And you get 2 more of those, whether they're transmitted at work or not. 3 cases in the same workplace during that 14-day rolling period has to be reported to VOSH, regardless of work relatedness. The other requirements for notification are that you're notifying your employees, the coworkers of any individual who's tested positive, those who may have been exposed to the confirmed case within 24 hours of learning of the possible exposure. Now, my understanding, and if anybody on this, any of my other co-presenters have a different view of this, is the may have been exposed is different than close contact. The close contact requirement, within 6 feet for 15 minutes or more, even aggregated, obviously those individuals would need to be notified if they've had a close contact with a confirmed case. The may have been exposed is broader than that, as I understand it. But if you have employees who may have worked in the same area, even if there was social distancing being followed, but they're sharing a break room, they're sharing a bathroom, and they're working in the same general area of the workplace, and it may have been exposed, they have to be notified within 24 hours. And anybody feel free to correct me if I've overstated that, and that really is limited only to close contact exposures. The other
no, Eric, I would agree with this is Susan. I would agree with you on that, but I'd also add that so it's only employees that are affected by that. So, for example, if you have an employee in the production facility that tests positive, clearly office personnel who never enter the production facility nor share restrooms or break rooms would not be affected, and therefore you would not have to notify them.
Right. Yeah. I think that's a good distinction. The other element here, so that's notifying your own employees who may have been exposed by a coworker who is also your employee. You also have a duty to notify other employers whose employees may have been exposed to your employee who it turns out is a confirmed case, again, within 24 hours of learning of that possible exposure. So if you have, if you're a subcontractor on a construction site and there's other subcontractors, or you're a host employer and you have vendors or contractors or subcontractors on your site and they have an employee who may have been exposed, you have a duty to notify their employer. So rather than notifying all of the subcontractor employees, you notify the employer whose employee may have been exposed to one of your confirmed positive employees within 24 hours. And then finally, if you are a facility owner, you have a duty to notify employer tenants. Again, employers, not their employees, but employers who are tenants in your facility that there's been a case that's discovered in the floors and work areas where that case was a positive case has been located. These are in addition, of course, to the hospitalization and fatality reporting that may be required under the long-standing reporting and reporting requirements for injury and illness reporting. I do think, if you have questions about whether something is reportable under the rule, my sense is that it would be virtually impossible for a hospitalization to be reportable under the rule, but fatalities could be. And I say that because the reporting rule has a 24-hour limitation. An employee is required to be admitted to the inpatient service within 24 hours of the exposure that caused an illness for that to be reportable. And that's just not how COVID-19 operates. There is a lag time, an incubation period before individuals experience any symptoms, usually, let alone symptoms so severe that they're being admitted to the hospital. So I have not looked at a set of facts that I determined would have been reportable as a hospitalization, but we certainly have seen, sadly, many instances of employees who have succumbed to the illness, and those fatalities could be reportable if they're determined to be work-related. But all of these notifications here are unique under the COVID-19 standard and do not contain a work-relatedness component, except, of course, if you're notifying the employees who may have been exposed to someone else, they may have been exposed at your workplace. There is intuitively or inherently a work-relatedness component to that. But in general, it doesn't matter where that initial case come from, whether it triggers one of these notification requirements. So I think now I'm going to turn it over to Susan and have you introduce yourself and share some practical tips and strategies from the field, which is where you've spent the last few months helping employers navigate this crisis.
Yes, thanks, Eric. So I am a lifelong health, safety, and environmental professional. I've been practicing occupational health and safety for over 30 years now in a variety of backgrounds and different sectors. But as Eric mentioned earlier, this year I've been eating, living, breathing COVID-19. And likewise, I've been serving as a subject matter expert to a number of our clients. So I am going to give you a boots on the ground perspective, if you will. At Safety Resource Associates, we've been supporting clients from the onset of the pandemic, even before the standard came out, in a variety of sectors, including manufacturing, religious organizations, service industry, and others. So I'm going to give you a boots on the ground perspective of the realities of complying with the standard, as well as just managing the pandemic in general in the workplace. So keeping COVID-19 out of the workplace has actually become more challenging than ever. When we talked earlier this year, we talked about some challenges. It has not gotten any easier. It's actually gotten more challenging. And that's greatly due to caution fatigue has set in big time. People are over it. Employees, the public in general, even supervision and management have grown weary of the COVID-19 prevention measures. In terms of feeling disconnected, employees and people in general feel disconnected more than ever. We recently had holidays. We had Memorial Day, Labor Day, summer vacation, and just got through Thanksgiving. And now we have Christmas and New Year's approaching. And as people feel more and more disconnected, they are eager and anxious to reconnect with family and friends at social gatherings. And so there's this sort of all or nothing mentality. I'm going to go to the grocery store, I'm going to wear my mask and keep my distance and do my hand sanitizer, but I'm going to go to that party this weekend and take off the mask and hug and share food and just forget all the COVID prevention measures. So it's a bit frustrating because, as we all know, it's perfectly possible to practice socializing while practicing the COVID prevention measures, but unfortunately that's not what people tend to do. We head back to school. We talked earlier this spring about the multi-generational workforce of people working together, living together, carpooling together. That is more so than ever. And I like to refer to it as that we're in the perfect storm. We have the pandemic, which is a public health crisis, but we also have an economic crisis that has gotten worse. And so this is more the case than ever. It's the only way people can afford to survive is to live together and vacation together and socialize together. So that's a factor as well. And again, about contact tracing, we do continue to strongly recommend at SRA to our clients that they do their own contact tracing and not rely on the health department or the temp agency or anyone else to do it for you. And there's a number of reasons for that. We offer what we call a line list. It's actually an Excel spreadsheet that's used by the health departments to track COVID data that we have modified for our clients. It's an excellent tool for tracking both cases and contacts. It helps you stay ahead of the curve to prevent outbreaks. It helps you track the data, which if you have not had any cases in your workplace or contacts, bless you, you're very fortunate. But when you do start having those, it can become quite confusing to track all that data. And the spreadsheet really helps you to do that. It also goes a long way toward impressing the health department and OSHA when they call, and they will. Right? You will get a phone call from them if you have an employee test positive. And it really goes a long way to have all that data organized at your fingertips, and it shows them that you're ahead of the game, you're on top of it. It really builds a high level of confidence and trust with the agencies. It's really important also to document and verify the information, such as test results, doctor's notes, and there's a number of reasons for this. Employees may misrepresent their situation unintentionally. This is a very fluid situation. It's very confusing. I am even seeing doctors get it wrong, right? It's just a very fluid, confusing situation. So it's easy to confuse the isolation period of someone who's sick versus someone who's in quarantine from contact. And so it's easy for employees to get confused. And unfortunately, they will also at times intentionally misrepresent their situation. They need a paycheck. Small to medium-sized employers who have, large employers who have greater than 500 employees are not required to comply with the CARE Act. So in those situations, in many cases, if the employee is out of work for COVID reasons, they are not getting a paycheck. And some of them have been out of paycheck for a while. So that's a situation you have to deal with as well as unfortunately, sometimes there is a lack of trust. Return to work policy. We recommend, of course, that you follow the CDC and Virginia Health Department guidelines, which Eric and Jennifer alluded to a little bit earlier. As many of you probably already know, the CDC just this week changed their guidance once again for their quarantine strategy for contacts. So now there's 3 options. There still exists the 14-day quarantine period for someone who's had contact with a test positive COVID case or a presumed positive COVID case. That's still the best option, but additionally, there is a 10-day quarantine if the employee continues to be asymptomatic and have no symptoms. There is also another third option, which is after 5 days, if the employee gets tested and tests negative, they can return after 7 days. So recommend that you follow that. Be aware, we're talking mostly about Virginia today, but I find myself reminding people that, as Eric mentioned earlier, other states are coming up with their own guidelines. So it's really important to be plugged into what's going on in your state and also be plugged into your local health department. What do I mean by that? Have the website bookmarked, refer to it frequently, call them, have a good rapport. Really important to have a good rapport with your local health department as questions and concerns come up. It goes a long way towards building trust and confidence. And look at each case on its own merit. Recommend against having any blanket policy that you just apply blindly because you really do have to look at each case on its own merit and its own nuances and get into the weeds a bit to manage them appropriately. Sometimes it makes sense to go beyond health department and CDC criteria when it makes sense to do so. Sometimes you'll find yourself needing to keep an employee out longer for a variety of reasons. And continue to recommend that you have a designated gatekeeper for this purpose at your workplace. This is not something to be done by committee for a number of reasons. There's HIPAA concerns with sharing medical information. There's a lot of confusion that we've already talked about. There's differences of opinions. There's a lot of differences of opinions out there. This is better managed by having a designated gatekeeper who applies the company policy for return to work, whatever it may be, consistently to each case. Again, really important to recognize that physical distancing is the antidote to quarantine, and this continues to be the case. So we know that the CDC recently changed their definition of close or direct contact. It is now within 6 feet with or without a mask for 15 minutes or more collectively over a 24-hour period versus casual contact. If you can create that in your workplace and enforce it consistently, it will go a long way toward minimizing the impact it will have on your workplace if someone tests positive. If you are enforcing physical distancing and practicing it effectively and an employee tests positive, it will have a minimum impact on the workforce. However, the flip side of that is if because of caution fatigue or lack of enforcement or whatever, you're not practicing and enforcing physical distancing, if an employee tests positive, you can take out a whole shift. We experience that probably once a week. That probably happens when an employee tests positive and the crew, and they say, well, the crews, we work together all week. They, right next to one another. Well, guess what? Now we have to quarantine the whole crew. So really important to enforce and practice physical distancing wherever possible. Health screening, we continue to recommend the health screening form. And again, that's a form that SRA can provide to those who are interested. It basically asks 2 questions. One is, are they experiencing symptoms, or have you been in contact with someone who's experiencing symptoms or tested positive for COVID? This is a form that employees, visitors, vendors, everyone who enters the facility completes and signs every day before they enter the facility. And it sounds very basic. We've actually found it to be extremely effective. It accomplishes 3 things. It prompts the employee to stop and think about symptoms they may be experiencing or contacts they may have had. And by initialing or signing that form, that tends to encourage integrity, and you'd be surprised how many times an employee will stop and say, well, I did play basketball with my cousin over Thanksgiving and he called me yesterday and he's got COVID. Well, then you really shouldn't be here. So that's a good way to screen out employees who may be potentially infected. It also creates good documentation for you. The other thing I want to talk about is temperature checks, which when we had this previously earlier in the year, I was not a fan. There's a lot of logistical issues that go along with checking someone's temperature, having someone check everyone else's temperature, lots of logistical issues, lots of challenges. It's not the simple cure-all that it might appear to be, and the return on investment just wasn't there. However, I've changed my tune on that a little bit as we approach flu season, and I think it's because of the masks, but we're seeing an increased number of strep throat, bronchitis, eye infections, ear infections. We started seeing these back in July and August, which you normally would not see them. Again, I think it's probably because of the wearing of the face masks. I think that having a temperature check may be a good way to keep the really sick people out of the facility. Let's be real, let's face it and be realistic here. A runny nose is a symptom of COVID. And because of the economic crisis, employers that are still open can't afford to keep employees out of the facility because of a runny nose. So we have found a wall-mounted thermometer that is working really well. It's designed and intended for this purpose. The person walks up to it, it takes their temperature, and it has both a physical and an audible alarm that sounds if the temperature is too high. So I'm changing my tune a little bit on that. I think depending on the employer's situation, that might prove to be very effective. And if anyone's interested, we can pass along that information. Unfortunately, yesterday, I went to buy it for a client and it was unavailable. I don't know if it's sold out. I'm not sure what exactly is going on there, but we can certainly help out anyone with that information if they would like it. Okay, so challenges with complying with the standard. Again, the biggest one overall that we are seeing is caution fatigue. And therefore, you have to up enforcement. Unfortunately, sometimes it's effective to use both negative and positive reinforcement, writing employees up for not wearing their face mask. And the way to approach that is this is a safety requirement. Not wearing your face mask is a safety violation, just like any other form of PPE. And unfortunately, you might have to have a formal disciplinary process to reprimand those employees. But we also recommend balancing that with a positive reinforcement, such as mask contests, who has the best mask, department contests. If everyone in the department is wearing their PPE correctly when the inspection is done, they get free lunch that day. You would be surprised how far that goes to not only boosting employee morale, but also encouraging people to practice the COVID-19 countermeasures you put in place. Another challenge we've had and clients have struggled with is training, which SRA has been able to help out with that a lot. So logistically, it's difficult to conduct training with the physical distancing in place. Most small and medium employers don't have the facilities, nor the technology, nor the know-how to accomplish that. So SRA can provide training, of course, in person with physical distancing. We're also able to provide virtual training to those clients. Also wanted to talk for a minute about management of change. So one of the big challenges, as Eric alluded to earlier, that we have faced with this is what I call it the perfect storm. We have the pandemic, which is a public health crisis, but we also have that combined with an economic crisis. And it's a very fluid situation, which employers that are still operating there's a lot of moving parts, and they have to be able to be very flexible. Therefore, things change a lot. And you really need to have a good management of change process in place so that the COVID-19 countermeasures don't fall through the cracks when changes are made. I'll give you an example. We had a client with a brand new facility in Richmond. We set up their COVID-19 countermeasures. They had the health screening form at the entrance, face masks, the signs posted everywhere. And we went back a bit later, and all of that, most of it had kind of fallen apart. They had had a number of personnel changes, and the people that were responsible for managing those countermeasures were no longer there or had different roles. They had also done some construction in the facility. So they had moved offices around, they had moved the employee entrance around, they were using a different entrance. Things like that, you'd be surprised that the COVID-19 countermeasures can fall through the cracks. So you want to have a good management of change process implemented. As Jennifer mentioned, it is most likely this standard is going to become permanent, and you're going to put processes in place that are sustainable for the long haul. And Eric alluded to earlier that we recommend everyone have a written program, whether you're required to or not. Not just a written program, but defined processes that define responsibilities of who's going to do what. SRA can provide that and have been providing that for clients. We also offer free updates. Again, because it is a very fluid situation, your plan needs to be updated frequently, and we provide free updates to our clients who use our written program. We can also provide training. Again, that's a challenge for a lot of small and medium employers to do that on site and at the same time practice physical distancing. So we also offer virtual training as a good option for that. And this is the contact information for safety resources. If anyone's interested in any of the information I've provided, this is Ed Bollinger, is our founder and president. This is his email as well as his phone number and the address to our website if anyone wants any more information. That's all I had.
Excellent. Well, thank you, everybody. We've consumed a lot of time, so like we've done in the past, I think what we'd ask you to do is you've got our contact information there. If you have questions that were not addressed by the presentation itself, please don't hesitate to reach out either to Susan or me. And then Jennifer included some information about contacting VOSH consultation if you have questions directly for the agency. We will be sharing a copy of this, a link to a recording of the presentation, a copy of the slides to everybody that signed up. We'd encourage you to check out other programs that we put on. My firm does a monthly OSHA webinar series. We've got our blog, the OSHA Defense Report, lots of great resources out there. This is, one of these situations where every day there seems to be a new significant change and update. And so we're doing our best to stay on top of that and keep everybody updated. So please don't hesitate to reach out to any of us if you have any questions or if there's anything we can do to help. And I just encourage everybody to stay safe and stay well. And I do feel like there's a light at the end of the tunnel with some of the news about vaccination. So hopefully this is in our rearview mirror and life returns somewhat to normal very soon. But in the meantime, a lot of great ideas here. And I think Virginia really did lead the way in this. Their rule has a lot of great components to it. I think in a more thoughtful way, even than a lot of some of the other states that are doing this. But there's challenges to implementing it. And if there's anything that we can do to help with that, please don't hesitate to reach out. Thanks, everybody, and stay safe.